Hi, my name is Rosemary Sweeting. This is my assessment of my patient. This is my patellar reflex hammer. This is my pen light, my otoscope just to look at his ears, even though it's not really needed. And then I also have my stethoscope for everything else. So I will go ahead and get started. Can you please identify how old you are? 47. Perfect. And do you understand that this will be recorded and will be uploaded into Canvas?
Yes.
And that the only person that will look at it is the person grading it?
Yeah.
Perfect. All right, I'm going to go ahead and get started. So the first thing I'm going to assess is his skin. I'm looking for temperature, turgor, the texture, and moisture. So upper extremities are warm. Lower extremities are warm. His head's a little sweaty, but that's to be expected. It's 75 degrees in this house. As far as turgor, his skin returned back to normal in less than 3 seconds, and the texture it's fine. It's smooth the way it should be. The next thing I'm going to look over is his head and his face. I'm going to assess his scalp. I'm going to assess the cranium. I'm going to assess some central nerve, some nerve reactions, and look for any infestations. So I don't feel any lumps or bumps, so I would say his head is normocephalic. I also was looking for any infestations, and there's no infestations. And then I don't see any like cuts or scrapes or bruises in here. So I think that would be fine. Go ahead and push against my head. Good. Push against this side. Beautiful. All right. So what I want you to do is I want you to look at the camera. Puff your cheeks out. You did fine. Raise and lower your eyebrows. Smile. Show your teeth. Good. All right. So that was normal. You can go ahead and look back towards me. Next thing I'm going to examine is his ears. No, his eyes. I'm going to look at his eyes. Go ahead and look straight ahead. I'm going to use my pen light to see if his pupils are contracting and dilating appropriately. I'm going to look at his sclera, and I'm going to look at his conjunctiva. And then I'm going to have him follow my finger to all 4 quadrants. So, bright light. Contracted. Oh, sorry, dilated. Dilated. Perfect. No, contracted. Sorry, contracted and dilated as appropriately. Looking at his conjunctiva. It's pink and moist. I don't see any styes or cuts, anything unusual in there. Same thing with this side. His sclera is a little bit red on the outer edges, but otherwise, for the most part, it's white and fine. I'm now going to have him follow the pen light to all 4 quadrants. So follow the pen light. Okay. Patient's eyes moved appropriately to all 4 quadrants. The next thing I'm going to look at is his ears. I'm just going to use the otoscope to look inside and just make sure everything's okay. I just replace the battery too. Any tenderness? No. Have you had any pain or itching? I don't know. Good. Okay. Ears are fine. Nothing going on there. I'm now going to look into my patient's mouth. I'm going to have him say ah, so we can see how his uvula moves. I'm then also going to look at his tonsils. I'm going to check the buccal and the mucosa and make sure that there's no cuts or lesions. Make sure everything is moist as it should be. Okay, open up. Ah. Say ah. Stick your tongue out. Say ah. Good. Tonsils look fine. I don't see any white patches. Tongue looks fine. I don't see any white patches. Pink and moist inside. He's doing good. Go ahead and stick your tongue out at me. Mm-hmm. That was a neurological check, one of the stroke checks, just to see if he's able to keep it midline, which he did. The next thing I'm going to check is his cervical. I need to check the TMJ. I need to check his TMJ. Before that or after that, I'm going to do cervical. So open and close your mouth. I didn't feel any popping or crepitus, nothing crazy going on. And the next thing I'm going to check is his cervical. I'm going to do one side and then the other so I don't cut off the blood supply. I'm not very good at the cervical lymph nodes, to be honest. Because I can hardly even feel. I know they're there. Okay, good. Lymph nodes seem like they're all there and doing what they're supposed to do. Now I'm going to do the pulmonary system. I'm going to listen to his lungs, anterior and posterior. Sit up straight. Deep breath. Okay. So while I was listening, I was also watching my patient breathe, and it rose up and down appropriately. I was also looking at his neckline. There's no JBD. Everything swallowed. Everything seems to be moving fine. Um, when I was listening to his lungs, I didn't hear any adventitious noises. There was no crackles, inspiratory or expiratory wheezes. There were no rails. His lungs sound great. So pretty happy about that. Um, Next thing I'm going to do is assess his cardiac system. I'm going to go from the midclavicular down to the fifth intercostal to listen to his apex. As I've stated, I don't see any agonal breathing. He's breathing just fine. So got that. Sit up straight. So he is slightly bradycardic. I did not hear any S3 or S4, no murmurs, no adventitious noises. I was aware prior to this that he is bradycardic. He works out, so that lowers his heart rate a little bit. Um, but otherwise, his cardiac system is pretty good. There's no flailing. He's breathing normally. He's not agonal breathing, which is good. The next thing I'm going to assess is his abdomen. The first thing I'm going to do is listen to his bowel sounds. Okay. Keep it straight. So on the first two run-throughs tonight, his vowels were hypoactive, but now they've gotten with the game and they're actually more normal active. I can hear some things going on. Now that I've listened to that, I'm going to go ahead and do percussion and see if I can hear percussiveness. Sounds good. And then the last thing I'm going to do as far as the abdomen is I'm going to palpate it lightly and deeply. So go ahead and lay back. I'm going to have him tell me if it hurts. This is light. Any pain? Let me know if you feel pain. No? So no pain upon light palpation, and now I'm going to do deeper. I don't feel like you probably could see me percuss, so I'll do it again. I'll do a bone. All right, go ahead and sit up. Thank you. Now I'm going to do some neurologic tests on him. The first thing I'm going to have him do is just go ahead and lay back on the bed. No, turn around. Put your head on the pillow. I want you to take the heel of your foot and run it up to your knee and then back down. Yeah. Okay, now do the other one. Perfect. Okay, so go ahead and sit up. I'm going to have you put your hands out straight, and I want you to touch your nose, or your finger to your nose. Good. Good. Right. Can you feel me do this? Yeah. Did you feel this? Yeah. Perfect. Okay, you can drop your hands and go ahead and get back into your comfy position. Thank you. Okay. Okay. The next thing I am going to check after the I need to do his patellar. I'm going to check his patellar reflexes. So just keep your leg kind of relaxed and loose. So just like. Okay. So he had good reflexes. And I just realized that one thing I forgot to do is check his gag reflex. So I'm going to rewind and go back to that really quick. Go ahead and open your mouth. I'm just going to stick your tongue out. Did I get you? Gag reflex works fine. So, sorry, out of order, but still done. We did that. We're gonna check since we're doing the muscular part. I'm gonna have him stand up, and we're gonna do the Romberg test. So go ahead and stand up. Face the camera. Thank you. I want you to close your eyes. Keep your hands by your side. Open your eyes. Close your eyes. So he wasn't swaying or falling, so he passed that. That's good. The next thing I'm going to have him do is bend down and touch his toes. His spine. There's no abnormal curvatures. Go ahead and stand up. There's no abnormal curvatures, so that's good. Now I want to have you bend over, bend backwards, side to side. Good. And another thing that I forgot to do was to check his abdomen for any abnormalities, so I'm going to do that really quick. So there's no like hernias or inguinal swellings or not inguinal, but any swellings or any abnormalities. And I think I got everything. I hope I got everything. All right. Concludes my video.